difference between chiropractic and physiotherapy?
Okay, the difference is quite big, but also quite similar in a way. So if we start at the beginning in terms of training, chiropractic is typically a 5-year double degree course, depending on where you go. Physiotherapy, typically 4 years in Melbourne or in Australia anyway. So 1 year slightly shorter. In terms of what we see, we're very similar. So we see a lot of community patients with musculoskeletal complaints, and that's the most common package that we see. The physiotherapist line of work can be different also because of their training. They train a lot in the hospitals in their undergraduate years. And because of that, they do a lot of work in the hospitals, such as, neuro rehab, they can do stroke rehab, they can do vestibular rehab, lots of different things. And they can branch into different lines like women's health as well, women's incontinence, pelvic floor training. They've got quite a number of subspecialties that chiropractors don't have. The chiropractors have some specialties, but one can, I guess, it's conjecture whether it actually is a specialty because it's not recognized as a specialty within the profession or outside of the profession. So it's hard to say. So there are differences between them both that way. Generally, the chiropractors are always community-based. In other words, they're in their private clinics, they're outside doing their own. So they have to basically have their own business, which means they are prone to competition, market forces. They always have to be good. They can be prone to illness. And so if they have illness, they can't work. Whereas a physiotherapist can be based either in the community, so same issues there, or they can be based in, say, a hospital environment where there's sick leave and there's cover and there's very little competition. They're just working amongst themselves. So it's quite a different nature environment to it. That said, in the hospital system, there's no way that they can have their own business. So they can't sell their business, there's no goodwill. And so that might be a downside. So one would say that the pay would actually be less. Security is higher if you get a job. And then in terms of future, a senior physio or chiropractor can be one of two things. We can both go into education, we can go to teaching younger students, depending on which country you're in. So say, for example, in the context of Singapore, a physiotherapist can teach in Singapore because there's physiotherapy in Singapore to some extent, you can do that. Whereas in Singapore, chiropractors can't teach because there's no college in Singapore, there's no students, you can't engage in medical students, you can't go to hospitals. So there's very little in terms of educational opportunities. So essentially in Singapore, a chiropractor, you're pretty much a practitioner. You may have a small group practice, you will work within a group practice, and that's your sort of endpoint, and you just do that. And when you want to sell the practice, that can also be difficult because, again, the nature of Singapore is that if I'm a chiropractor coming in, I can just set up a practice and just next to you, and I don't have to buy your goodwill. It's quite different. Physiotherapy, you get the same problem. Okay. Lastly, in terms of technique-wise, the chiropractors and physios are slightly different. Chiropractors are much more focused on spinal manipulation. They can do extremities, so wrists, hands, limbs, other areas. And our techniques are slightly different. We use what we call HVLA, high velocity, low amplitude thrust, to get our manipulations. Whereas physiotherapists, they can use some manipulation. Most physiotherapists will do some manipulation in training, but the physiotherapists that I know in Melbourne that I refer to as a doctor who do spinal medicine or spinal physiotherapy, they tend to go for specialized training, which is another 2 years to become musculoskeletal physiotherapists. So that's a point of difference between the two. So the techniques are slightly different. Physios tend to be more rehab, exercise-based, which is good, and that's one way to do it. And then chiropractors tend to be more manipulation-based, but that's also changing depending on the type of chiropractor that you see.
So what advice would you give someone who's trying to decide between a career in chiropractic and physiotherapy?
Yeah, good question. One of the big things is where you want to be at the end of your life in terms of your professional career. And if you're the type that wants to have a business of your own, you want to manage your own practice, and you don't want the hassles of politics, then to do that, you can be in either profession, that's fine. But if you're the type that likes social collegiality, you like research, you like education, you like a variety of things, which is things that I do, then you find that probably physiotherapy gives you more options in that realm. Now that's because we're talking about the Singapore context. We're not talking about the Australian context, which is quite different. In Australia, we can do a number of things as chiropractors here, but I won't speak of that context. So the best advice I can give is probably go and observe senior practitioners and see what they're doing and ask them how they feel their sort of professional life or career has been in Singapore.
Right. So then what about a patient? Does a patient with a problem have to choose between a chiro and a physio? Or is there a way to combine the two?
Yep, it's quite different because like in any profession, there are good practitioners and there are bad practitioners. I wouldn't say bad, but maybe just not as good in one area versus another. There might be differences in personality traits and there might be differences in techniques and interests. So what I would suggest is always ask the professionals. So if you have a good GP, who's a good chiropractor, who's a good physio, you can ask your friends and colleagues. That doesn't necessarily mean they're good, but at least it's a base to go off from. What I would say is Google reviews and online reviews are a very bad way to do it because that's so easily manipulated and should not be a basis of choosing somebody. The second way to look at it, if you're a bit more interested, is to look at their professional background. And if they come from, and if you know the different universities and what their backgrounds are like, if you see a strong institutional link, such as if they're linked in with SGH or one of the local hospitals, or they've trained in a local hospital, or they've trained overseas in a big hospital institution, it tends to lend a bit more credibility to their weightage. I'm not sure about the physiotherapy registration in Singapore, but I think they would be registered practitioners and they're controlled. So that therefore you can call the association and also ask them if there's any issues with the physio that you're looking at, whether he's had any reprimands or any concerns. Chiropractors are not registered, so you have no way of knowing their background as to how they've performed in their career and whether there are any outstanding issues there of professionalism. Unlike in Australia or in other countries where chiropractors are registered, that can be found out pretty easily.